Cervical cancer is a type of cancer that develops in the cells of the cervix, which is the lower part of the uterus that connects to the vagina, or what we call in Tagalog as kuwelyo ng matres. It usually starts with abnormal changes in the cells of the cervix, which can progress to cancer if left untreated. So most cervical cancers are caused by persistent infection with what we call as high-risk types of human papilloma virus, or HPV, which is a sexually transmitted infection. So what are the symptoms of cervical cancer? Cervical cancer often has no symptoms in its early stages, which emphasizes the importance of regular screening with a Pap test and HPV tests for early detection and treatment. As cancer progresses, symptoms may now include abnormal vaginal bleeding, such as bleeding between periods, bleeding after intercourse, bleeding after menopause, pelvic pain, pain during sexual intercourse, and unusual vaginal discharge that may be watery, bloody, or have a foul odor. So can cervical cancer be prevented, and how? Prevention of cervical cancer primarily involves or revolves around vaccination against the human papilloma virus, which is the primary cause of cervical cancer. Additionally, regular screenings with Pap tests and HPV tests are essential for early detection of abnormal changes in cervical cells that could lead to cancer. Other preventive measures include practicing safe sex, limiting sexual partners, avoiding smoking, and maintaining a healthy lifestyle. What tests do I have to undergo to be diagnosed with cervical cancer? To diagnose cervical cancer, several tests may be necessary depending on the patient's symptoms, the medical history, as well as the risk factors. The primary screening tests for cervical cancer include the Pap smear and the HPV test. If abnormalities are detected in these initial screenings, further diagnostic tests may be performed, such as a colposcopy, where a special instrument with a magnifying lens is used to examine the cervix closely. Where can they avail of this test or tests? Tertiary hospitals like the Perpetual Medical Center, Las Piñas, would have a complete armamentarium for diagnosing cervical cancer. HPV testing and HPV vaccinations are available in the clinics. What happens when one is diagnosed with cervical cancer? When diagnosed with cervical cancer, a multidisciplinary approach becomes paramount to ensure comprehensive and effective treatment. Following the diagnosis, a team of healthcare professionals would usually collaborate to tailor a treatment plan that is specific to your condition and your needs. Treatment options may include surgery to remove the cancerous tissue, radiation therapy to target cancer cells with high-energy beams, chemotherapy to destroy cancer cells throughout the body, or a combination of these approaches. Additionally, supportive care services such as pain management, nutrition therapy, and psychological support are integral components of the treatment plan to address the physical and emotional aspects of living with cancer. Regular meetings and discussions among the multidisciplinary team ensure coordination and continuity of care, optimizing outcomes for individuals facing cervical cancer. This collaborative approach focuses on treating the disease and emphasizes quality of life and holistic well-being throughout the treatment journey. At Perpetual Health Medical Center, we are proud to have this complete team of healthcare professionals. What can you advise patients with cervical cancer? It's important to educate oneself about the condition. Open communication with your doctors is essential. Building a strong support network of family, of friends, and doctors can provide emotional support and practical assistance throughout the treatment process. Taking care of one's physical and emotional well-being through healthy lifestyle choices, through stress management techniques, and and seeking support from counselors or support groups can help cope with the challenges of living with cancer. It's also important to follow the recommended treatment plan, attend regularly follow appointments to monitor progress and address any concerns promptly. And lastly, maintaining hope, staying positive, and focusing on small achievements every day can help maintain resilience and optimism during the journey towards healing and recovery.